All right, welcome to chapter 30, and this is going to be part one of two parts. In this chapter, we're going to talk about trauma systems as well as get into a little bit on mechanisms of injury. We're not going to deep dive into any specific traumas. All that's going to come in some chapters a little bit later. The chapters following chapter 30 is going to go into specifics of trauma as they relate to particular body systems. So let's go ahead and get started. Of course, trauma is the leading cause of death and disability for people between the ages of 1 and 44. And that's typically because this age group is the most active among the age groups and probably contains the largest amount of risk takers. So we expect to see that there's going to be more trauma-related death and disability in this group. Doesn't mean it doesn't happen in the other groups. It's just some other things kind of pushed it out of the number one spot as we're younger and older. So, understanding the basic mechanics and biomechanics of trauma is really going to help you assess and manage your patient's injuries much more effectively, as well as being able to analyze the trauma scene, because this is a very essential part of the whole patient care process. Remember, in the field, you serve as the eyes and ears for the emergency department and the trauma team. Your documentation that you're going to provide to the physicians and the emergency room staff are going to provide those critical details about how the incident occurred and what forces acted upon that person's body and caused the injuries. So let's define trauma. I think it's important to give it a true definition. So trauma is an acute physiologic and structural change. So it changes whatever part of the body that it comes in contact with. Physiologically, how it functions, as well as structurally how it's made. And this occurs when there's an external source of energy that affects the body beyond its ability to sustain and dissipate that injury or that energy. So when there's more energy that comes into contact with the body than it can sustain or dissipate, that's when we're going to wind up with trauma or damage to the tissues or damage to the body's ability or organ system's ability to continue to do the things that it normally would do under normal circumstances. There's different types of energy that can cause different types of injuries. The first that we're probably most familiar with is that mechanical energy. It involves energy from motion, kinetic energy, or energy from a stored object that's known as potential energy. Chemical energy is released during a chemical reaction that can cause burns or tissue damage. Thermal energy results from contact with a heat source that is hotter than the body can withstand. Electrical causes injuries when electricity or lightning passes through the body. And of course, barometric energy comes from sudden and extreme changes in air pressure, either high or low air pressures. All just depends. When we talk about the biomechanics and kinetics of energy, we're talking about two different things that kind of correlate together. The biomechanics is the study of how living organisms move and function using the principles of mechanical engineering. It helps to explain how forces cause specific types of injuries and can guide your assessment of trauma mechanisms. So it's important to understand how the biomechanics of the body normally works so that you can understand how trauma will affect those biomechanics. And of course, kinetics is a study of how speed, mass, direction, and force interact to produce energy or move energy or change it, those types of things. Understanding these kinetics can allow you to better predict the types and severity of injuries that you might expect to see with your patient in a given situation. Factors that affect the type of injury that our patients might see, there's going to be different types of injuries that we'll see in our patient. It's going to depend upon how well their body can absorb or disperse the energy that's involved. External factors such as the amount of force and energy play a major role in determining the injury patterns. The size or mass of the object, its velocity, acceleration, deceleration, and the specific area of the body that is impacted also will greatly influence the outcome. The duration and direction of the force is also key considerations, but not necessarily more contributing factor over another, which you'll learn in later chapters. When the force is spread over a large area, the pressure on any single point of the body is reduced. So sometimes that's beneficial, sometimes not so much. Blunt trauma occurs when energy is dispersed across the body without breaking the skin, often making it harder to recognize since external signs may be minimal or they're much slower to develop and we don't see them for minutes to hours later when those signs of blunt trauma begin to show up. Energy delivered suddenly is less tolerated than the same amount applied gradually over time. The patient's position at the time of the injury can affect the type of the severity of the trauma. Seatbelt use, clearly, we know this, helps reduce fatal injuries by keeping occupants in that particular position, and it makes it less likely that they're going to that it's going to result in deadly trauma by keeping them in that particular position in the car, because where the seats are in the car is the areas that are designed to protect the people that ride in the cars. Anywhere outside of those seats is not designed for someone to ride, and there's no protections for them. It's not a safe place to be in an accident. The body's ability to resist impact affects how tissues are damaged during trauma. Organs that contain gases or air, such as the lungs and intestines, compress more easily and are more vulnerable to pressure changes, but sometimes they respond better to blunt forces. Organs filled with liquid, like the liver and the spleen, are less compressible and tend to tear or rupture when exposed to blunt forces, but they're less affected by the gases, the gas changes or pressure changes. Understanding how the forces of energy are transformed helps you evaluate the mechanism of injury. This knowledge will allow you to anticipate the most likely types of injury based on how the trauma occurred. Always maintain a high index of suspicion for hidden or hard to detect injuries whenever there's a lot of force involved, or especially if that force is a twisting type of a force. There's almost always some hidden injuries that we don't discover, or that may not be readily apparent right away, that may begin to show up later. That's why your reassessment is key. All right, so let's talk a little bit about kinetics. Of course, when we dive deeper into kinetics, there's words that we're going to use: velocity, acceleration, gravity, kinetic energy, those types of things. So let's look at those things more closely, individually, and discuss them just a little bit. Of course, velocity is the speed of an object in a specific direction over a given period of time. The key difference between speed and velocity is that velocity includes direction while speed doesn't. So that's the big difference between velocity and speed. Acceleration refers to the rate at which the object's velocity changes over time. Is it accelerating or is it decelerating? Gravity is the downward acceleration acting on an object moving toward Earth. An object's speed increases about 9.8 meters per second for every second that it falls. So it's called terminal velocity. But as an object falls from a height, it picks up speed for every second that it is in free fall. It'll pick up about 9.8 meters of speed per second. It'll increase. Kinetic energy is the energy that an object has because of its motion, and it depends on both its mass and velocity. So when we look at the kinetic energy of an object, for instance, if somebody throws a wadded up piece of paper at you, they can throw it really, really fast. They can give it a lot of velocity, throwing it very straight and very fast. and it's going to make impact with you, but it's not going to cause any harm to you. However, if we take if we take the same speed that paper, that wadded up piece of paper was traveling, and we use a bowling ball instead, and we throw it at exactly the same speed and exactly the same direction, it's going to cause a significant amount of damage to whatever it impacts, because not only does it have velocity, it has mass. So there's a lot of energy involved to move a bowling ball, a lot more energy involved to move a bowling ball than there is to move a piece of paper. So think of this when you're going out on automobile accidents and you're considering the difference between the kinetic energy of a motorcycle versus a semi. Which one's going to have a lot more kinetic energy? Of course it's going to be the semi, because it is a large, massive object moving at a particular speed, and it's going to take a lot of effort to stop it, versus a motorcycle could stop relatively quickly. Of course, kinetic energy is calculated by using a particular formula. Of course, it's 1/2 times mass times velocity squared. I can't think of a single time in your career that you're going to use that, but it helps to give you an idea of how that number, there is an actual number that can be calculated by it. Remember that velocity has a much greater impact on kinetic energy than mass does. So we can actually take an object that is much smaller and move it at a much higher rate of speed in a particular direction, and it can have a greater impact on kinetic energy. Now, we could potentially take that same wadded up piece of paper and make it travel at such a high velocity that it could potentially cause more damage than the bowling ball. That's what we're talking about here. So while the mass and the size of the object is important, its relative speed is also important as well. So we can take that same motorcycle versus in a semi, but we can make that motorcycle travel 3 times faster than the semi. Say the motorcycle is going 90 miles an hour versus the semi going 30. The damage that the motorcycle is going to cause at 90 is going to be greater than the semi will, relatively or potentially, or could be close to the same, because as the velocity increases, the mass of an object, the mass difference in two objects changes. They start to become closer together. So there would be a point in time to where as the speed of the motorcycle, we could have the speed of the motorcycle that is so great that it would cause the exact same amount of damage that a semi would at 30 miles an hour. I don't know what that number would be. I'm sure there's a mathematical formula for it. But you kind of get the point that velocity, as we speed that thing up, as we speed the velocity of the motorcycle up, it begins to contain more kinetic energy. Hopefully that's making sense. When a moving vehicle stops suddenly, its kinetic energy must be transferred to another object or absorbed in some way. As you're approaching a stop sign or a stoplight, that energy is transferred to the brakes. The brakes on the vehicle, when we apply pressure to the brake pedal, it transfers that energy, that moving force of energy, to the brakes, and the brakes will heat up because it's trying to dissipate this energy. Absent the brakes, though, and if it's some outside force that it acts upon, we're going to see if it impacts another vehicle or another object, then we're going to see how that energy is transferred. When you look at a couple of vehicles that have collided and you see the rippled metal and broken glass, that is an indication of the energy that was transferred or absorbed. And that's why they make vehicles the way that they make them now, to where that they are able to absorb that energy in a much more efficient way, so that it protects the occupants of the vehicle while the vehicle itself is completely destroyed. So these are what's known as crumple zones, and they absorb as much of this energy as that possibly can by deforming on impact. and helping protect those of us that are riding inside of these vehicles. Doesn't work out well for the vehicle. However, we're able to walk away, or at least maybe after a little bit of time of healing, we're able to get back to a normal life without it causing catastrophic or fatal injuries as earlier versions of automobiles did. Several factors are going to influence how this energy is dispersed during a collision. Of course, angle of impact, such as it's a frontal or side impact, affects how those forces are distributed and how the occupant strikes the interior of the car. The size and weight of vehicles involved is also going to play a major role in that. The use of restraints or protective gear will also affect how much energy is transferred to the occupants within the vehicle. And each vehicle in a collision contributes its own kinetic energy to the overall impact. So if you have multiple impacts, like we've seen those pileups on the interstate, one car gets hit by another car in the fog, and then a semi hits those two cars, and that lead car just keeps taking impact after impact after impact and absorbing more and more kinetic energy. Unfortunately, the car can only absorb so much, and it's going to transfer some of that energy to the occupants in the vehicle. That's where we come in, and that's because that's what causes injury to people. Our soft, fleshy bodies do extremely well at absorbing energy, not in a healthy way, but they absorb a lot of energy, but it causes a lot of damage when it does. The law of conservation of energy states that energy can't be created or destroyed. It can only be transformed from one form to another. Like I had mentioned earlier, when we're slowing down and coming up to a stop sign, all the energy, the velocity of our vehicle that's moving forward has to be transferred somewhere, and it's transferred to the brakes. If we don't transfer it to the brakes, then we act upon another force, maybe another car, or we impact another car. If nothing happens and we just let off the gas, it will literally coast eventually to a stop. And that's because of a couple of factors that we're dealing with here. It's the friction of the tires on the road, as well as the resistance of the wind. All of the molecules in the air create wind resistance, and that's why we feel when we stick our head out of the car going down the road, we have wind blowing in our face, and that's because of all the air molecules blowing, striking us, and that's wind. If we go out into outer space and we hurl an object, a vehicle in outer space, nothing will stop it until it impacts something, because there's no wind resistance and there's no friction of the tires on a roadway or anything like that. There's nothing to slow it down. It will not lose speed. It will not gain speed. It'll stay at the same speed until something else acts upon it to slow it down, stop it, turn it, whatever. It'll continue to go in that same direction. So energy is dissipated. Energy dissipation is the process by which kinetic energy is converted to another type of energy. And that's what we see when we're applying the brakes, or when there's an accident, or if we coast to a stop, that dissipation of energy that happens. When it stops gradually, that kinetic energy is primarily converted to heat by us stepping on the brakes. However, during a crash, it's also converted into mechanical energy, which causes injuries. So that's where those injuries come into play. Safety devices in cars are designed to control how that energy is dissipated, such as seat belts and airbags, and these are going to help to reduce the severity of injuries. At least that's the goal. So Newton's first law states that an object at rest will stay at rest, and an object in motion will stay in motion unless acted on by an outside force. His second law explains that the force of an object can exert equal to its mass multiplied by its acceleration or deceleration. This relationship is expressed as force equals mass times acceleration, which is exactly what we've been talking about. In a roundabout way, we've talked about Newton's first law of motion and his second law of motion. Remember his first law of motion, those objects are going to stay in motion. If it's at rest, it's going to stay at rest. If it's in motion, it's going to stay in motion. However, here on the planet Earth, because we have gravity and we have atmosphere, those objects are being acted upon. Any object in motion is being acted upon by both gravity and the atmosphere that's causing the wind, and the gravity that will cause the friction on the earth, or it will pull it. If it's an airplane, it pulls it down towards earth. Airplanes are always fighting against gravity to try to stay in the air, and they use air kind of to help keep them aloft. And of course, the second law has to do with, its mass, the mass of the object, and how much force it will exert. The greater an object's mass or acceleration, the more force is required to change its direction or speed. So a semi-truck going down the interstate at 70 miles an hour is going to take a lot further to stop than a motorcycle going down the interstate at 70 miles an hour. It's going to take a much further distance for the semi than the motorcycle. However, if we speed that motorcycle up to about 190 miles an hour or so, it's going to take the motorcycle a lot more time to stop. It's going to, eventually it will equal out. The stopping distance of the two will equal out because of the speed that's involved, the velocity that's involved. Deceleration is going to occur when an object slows down rapidly, and it's going to produce a large amount of force. Acceleration and deceleration can be measured by g-forces, which we hear them talk about all the time, in the military planes, how much g-force is on a particular person, where 1 g equals the normal force of gravity. So when somebody says they took a turn in a jet and it was 6 g's, that is 6 times the force of gravity pulling on them, either pushing them one direction or pulling them another direction. 2 to 3 g's represent the force of 2 or 3 times greater than gravity. The human body can generally tolerate up to 30 g's of deceleration. I can't imagine. In a head-on collision, the total energy transfer is roughly equal to the sum of the speeds of both vehicles involved. So 2 vehicles collide at 60 miles an hour, it's 120 mile an hour impact. And of course, you'd have to factor in the weight of the vehicles and the occupants and all those kinds of things to make a determination of the G-forces involved. Newer vehicles actually contain smart boxes or black boxes that record the G-forces involved in collisions and those kinds of things, and they're becoming a little bit more and more commonplace. I suspect there'll be a time when we as medics will have access to that data fairly readily, so that we'll have a better idea of how much force was deceleration force was involved in a particular accident. Multi-system trauma refers to injuries that affect more than one body system. These usually result from events that impact the entire body. It is common for both blunt and penetrating injuries to occur in the same patient. So when multiple body systems are suspected, assess the patient's entire body carefully, because we might find different types of wounds on them. Be sure to prioritize your treatment based on the severity of injuries that you find, and transport the patient promptly to ensure timely care. We want to make sure that we not only transport them promptly, but we get them to the right location, the right hospital. Now, blunt trauma occurs when the body is injured without being penetrated by an object. It commonly results in motor vehicle crashes. This is where we see it a lot. Maybe pedestrians struck by a vehicle, motorcycles, falls from heights, even sports injuries, as well as blast injuries. We oftentimes think of the penetrating effects of a blast injury, but that pressure wave in a blast actually is a form of blunt trauma. 5 phases that we typically see in trauma are related to the progressive deceleration when a vehicle collides with another object. Phase 1 is deceleration of the vehicle. When the vehicle strikes an object, it comes to a sudden stop. While the vehicle's motion continues until its kinetic energy is fully dissipated. And that's why we see these crumpled up vehicles. Phase two is deceleration of the occupant. This begins when the sudden braking, and continues throughout the crash impact. This phase can cause deceleration, compression, even shear injuries depending on the occupant's mass and the direction of the impact. Vehicle safety features, body parts involved, and points of impact can all play a role in that as well. So there's a lot of variables that come into play, but oftentimes by just taking a good look at the vehicles involved, you can begin to get an idea of the forces that were in play, causing the potential damage to your patient. Phase three is the deceleration of internal organs. This occurs when organs continue to move forward until they're stopped by an anatomical restraint, which can cause tearing or shearing injuries depending on the organ. And then the secondary collision happens when the occupants are struck by objects moving inside the vehicle, such as the box they were taken to Goodwill that was sitting in the back seat, and they get clobbered by a box of old junk that they didn't want. These oftentimes lead to severe head and spinal injuries as well. And then there could be some additional impacts that involve the vehicle being hit again or deflected into another object, which can worsen existing injuries or make new ones. Maybe they get hit and it spins them and they roll and they hit another object or something along those lines, and that's the final phase of that impact. Impact patterns are the amount of vehicle deformation gives us clues about the forces involved and how much deceleration the patient may have experienced. In frontal or head-on collisions, the front of the vehicle crumples to absorb that energy and slows the vehicle. And this is actually where the bulk of the crumple zones and protective areas are for people, because most impacts are from the front. Passengers will decelerate at the same rate as the vehicle, exposing them to similar forces. So when we look at how much damage is to the vehicle, the patient has sustained that much force as well. They had to endure that. The forces on the driver may vary depending on the vehicle's design, what it's made of, and the safety features that it has. Sudden stops can cause abrupt deceleration injuries, which may shear, avulse, or even rupture some organs. These injuries are often hidden and are not immediately visible during an exam because, they're buried down deep inside, and the signs of these may not show up for some time, by bruising or those kinds of things that we would expect to see. So we have to kind of use our detective skills and keep alert for those things that may have happened. Of course, the head is highly susceptible to deceleration injuries, which can cause the brain to strike the inside of the skull, lead to bleeding, bruising, or tearing that may be invisible on exam. Always maintain a high level of or a high index of suspicion for head injuries after a sudden deceleration. The aorta also is the most common site of a deceleration injury in the chest, and it can literally tear away from its fixed points and potentially cause a rapid blood loss and ultimately death. Internal organs that continue moving after the body stops can experience tearing or shearing. Organs commonly affected, of course, are going to be the liver, which we see a lot, kidneys, small intestines, pancreas, and even spleen. When we have crush or compression injuries, that's when these external forces compress parts of the body during impact. Compression of the head may result in skull fractures and is often linked to cervical spine injuries, as well as spinal cord and brain injuries. Brain swelling inside the skull can worsen neurological damage, and compression of the chest can fracture ribs, injure the heart, potentially causing dysrhythmias or even direct myocardial damage. Compression of the lungs may lead to acute respiratory distress syndrome, and the force from a seatbelt can cause the bowel or bladder to rupture, maybe even tear the diaphragm, cause some spinal injuries, and even result in severe bleeding. So all of these things we need to be aware of and be prepared for. Remember, all of this energy is being transferred. Unrestrained occupants typically follow one of two movement patterns during a crash. They may take the down and under pathway, which occurs when the occupant slides under the steering column or dash, causing the knees to strike the dash. In this pathway, deceleration energy travels up the femurs to the pelvis, while the upper torso continues forward until it hits the vehicle interior. Injuries to watch for, of course, are going to be femur fractures, knee fractures and dislocations, hip and pelvic fractures, hip dislocations, spinal injuries, rib fractures, and pulmonary and cardiovascular trauma. The other route that they often take is the up and over pathway, and it starts with the head leading the movement, often causing severe head and cervical spine injuries. This pathway can result in ejection from the vehicle. It can be reflexivity, taking deep breaths just before the impact can worsen lung injuries, so that them seeing the impact that's about to happen and taking a deep breath can cause lung injuries. And of course, lower leg fractures may also be present with this pattern as they kind of get hung up on the steering wheel as they're being thrown up and over into the windshield. Lateral or side impacts transfer energy directly to the side of the occupant's pelvis and chest. This is oftentimes the places on vehicles where there's the least amount of protection for the occupants, especially as the speed or the velocity of the vehicle that's striking them increases. Seatbelts provide minimal protection in these collisions. They do, however, help to keep the person in that, attached to the seat, which is helpful, but it doesn't provide a whole lot of protection. As the vehicle deforms, the passenger's head may strike the impacting object or something inside of their own vehicle. Injuries are going to result from direct trauma on the side of the impact and tension on the opposite side of the body. The shoulder often rotates outward and backward, exposing the chest and ribs to injury, which can cause rib fractures, flail chest, and lung contusions. The body then moves in one direction while the head moves towards the impact, potentially leading to spinal disruptions and dislocations. Occupants may collide with each other inside the vehicle as well. Pelvic injuries are very common and involve lateral compression and disrupting the pelvic ring. Death is usually caused by associated injuries to the torso and head by being pushed into the largest area of impact, where the body basically becomes a crumple zone for the car. Rear impacts generally result in higher survival rates when the occupants are properly restrained. Whiplash is a common injury in rear collisions. While much of the collision energy is transferred to the vehicle in front, the backs of vehicles are, while they are built to take some impact, unfortunately they don't take impact like the front of the vehicles do, and with enough impact like this picture here, we wind up seeing the vehicle essentially parked in the back seat of the vehicle, and that's where occupants in the back are most susceptible to a rear collision. Rotational or those quarter panel impacts happen when a side collision strikes the vehicle off center, so it catches the front or the back of the vehicle right around where the wheels are. The area where the vehicle slows the most abruptly usually causes the most severe injuries to the occupants. So that rotational turn of that. Occupants in these crashes often sustain both frontal and lateral injuries, and 3-point seatbelts are effective at reducing injuries in angled crashes at up to 45 degrees, but it's not uncommon to see these patients with lower limb fractures of both tibia and fibula on both legs, literally because of the rotational impact and how it twists the body while it's inside of the vehicle. It's hard to think of it that way, but it does. It can twist it so much that even without impact, both lower limbs can break. Rollovers carry the highest risk of fatal injuries. Occupants may be ejected or even partially ejected or slammed up against the interior of the vehicle multiple times. Being ejected from a rollover increases the risk of death by 91 times or 91%. I don't know what they're talking about here, but clearly not staying in your seat inside your vehicle increases the risk of death. Seat belts halt the motion of the occupants traveling at the same speed of the vehicle. They reduce contact with the interior of the vehicle by helping prevent ejection. They also distribute those deceleration forces over a larger area of the body. They can prevent occupants from colliding violently with each other inside the vehicle as well as the interior components of the vehicle. And injuries specifically linked to seatbelt use can include cervical fractures as well as neck sprains and strains. Airbags have reduced fatalities in direct frontal impact motor vehicle crashes by roughly 30%. Front airbags do not deploy in side impact or front quarter panel collisions. Airbags can cause secondary injuries from direct contact from other chemicals used to inflate them. Sometimes it's not unusual to see bruises and those kinds of things. Small children in the front seat are at a very high risk of severe injury or death from airbags deploying, because oftentimes those airbags will catch them right under the chin or at the top of the head, and it tilts their head back violently with a lot of force and causes cervical spine fractures, leading to nearly immediate death. Motorcycle crashes. Riders rely entirely on their personal protective gear that they're wearing for protection during a crash. This equipment's going to include helmets and abrasion-resistant clothing such as leather jackets, pants, and boots. When assessing a motorcycle scene, note the deformity of the motorcycle, observe which side of the motorcycle sustained the most damage, and measure the distance of any skid marks on the road. Check for damage to stationary objects or other vehicles involved, and examine the helmet for the extent and location of any deformity or marks, scuff marks or anything on the helmet. There are four main types of motorcycle impacts that we deal with. Of course, head-on occurs when the motorcycle strikes an object and stops suddenly while the rider continues forward until stopped by an external force. On motorcycles with low seats, the gas tank can wedge against the pelvis, potentially causing severe anterior-posterior compression injuries and open pelvic fractures. Angular impacts happen when the motorcycle hits an object or vehicle at an angle, crushing the rider's lower extremity between the bike and the object. Injuries from angular impacts can include severe open comminuted leg fractures, traumatic amputations, thoracico-abdominal torsion, lateral spine injuries, head trauma, and even pelvic injuries. One of the others, the third one, is ejection that occurs when the rider is thrown at a high speed and still stopped by a stationary object, another vehicle, or even the road. And then, of course, the last one is laying the bike down, which is a technique used to separate the rider from the motorcycle and the object they might hit. And this is going to help to reduce direct trauma. What happens is when they lay that bike down, they start to kind of transfer that energy and ride that bike laid on the ground as long as they can while it's grinding to a halt. And then eventually they can kind of kick away and separate themselves from the bike. And, hopefully we'll have reduced a lot of the kinetic energy by that time. Remove a helmet carefully if the airway management cannot be performed with it on, or if the helmet does not fit snugly. Treat any dents or abrasions on the helmet as potential cervical spine injuries until imaging proves otherwise. Bicycles, off-road vehicles like ATVs and snowmobiles can cause injuries similar to those seen in motorcycle crashes. I'm not sure how many of you are aware, but the side-by-side style of ATVs or UTVs are now street legal. However, they're not built to sustain crashes with full-size vehicles that are on the roads. They're not built with crumple zones and those kinds of things, but we are seeing a lot more of them on the roads. Fortunately, they're not allowed on the interstates. Most people typically keep them off of the highways, but they can be driven on the highways. But just realize that you're going to see they do have seat belts and those kinds of things, but if they're involved in in a collision, they don't have airbags or anything like that. Most of them don't even have doors. The injuries that the patients will sustain may very well be catastrophic. Pedestrian injuries: about 85% of pedestrians are hit by the front of a vehicle. Adult pedestrians usually sustain lateral and posterior injuries because they tend to turn away from the vehicle, while children will turn towards it. There are three main mechanisms of injury for pedestrians. The first impact is when the vehicle's bumper or the front of the car strikes the body. The second is the adult is thrown onto the hood or the grille of the vehicle. And the third, the body hits the ground. It bounces back and falls back on the ground. It's a little different for children, where they may go from the first impact to the third impact a little more quickly because they may not actually get thrown up onto the hood of the vehicle. As I mentioned, the pedestrian injuries are going to differ greatly from those of adults. There's the Waddell triad, describes the most common injury pattern for children or shorter individuals. When this pattern, the vehicle bumper strikes the pelvis and femur rather than the knees and the tibias. The chest and abdomen impact the grille and the lower hood of the vehicle as well. The head then strikes the vehicle and subsequently the ground. And we can kind of see how that plays out in this image here and why the injuries can be so devastating. When we talk about falls, we're talking about falls from heights greater than standing height. Remember that in a fall, the body will accelerate downward at 9.8 millimeters per second squared. The severity of injury depends on several factors. Of course, first of all, the height of the fall will determine its velocity along with the stopping distance. This predicts the magnitude of the deceleration forces that are at play. The position during the fall influences the type of injuries and survival chances. Children often fall head first, while adults usually try to land on their feet. The Don Juan syndrome describes injuries from a vertical fall to a standing position, including a foot and lower extremity fractures, hip pelvis fractures, vertebral compressions, and burst fractures. There may be even organ injuries from vertical deceleration and forearm and wrist fractures if they're trying to catch themselves going head first. The area of impact matters. The larger the contact area, the better it's going to dissipate the forces. So the smaller the contact or impact area, the greater the damage may be to the whatever is making contact first. Surface type also is going to affect energy absorption, as a more deformable surface reduces deceleration forces. So if you fall in the sand versus falling on the pavement. And the physical condition of the person falling influences that injury severity, with conditions like osteoporosis, which will increase fracture risks, and certain hematological disorders that are going to increase the likelihood of organ ruptures and bleeding. Penetrating trauma occurs when the skin and underlying tissues are pierced by in a small focused area. It is usually classified as either low, medium, or high velocity impacts or penetrations. Low velocity injuries are caused by sharp objects moving through the body, such as a knife or something along those lines. Medium high velocity injuries are usually from bullets and are harder to predict because the projectile may tumble, it may flatten out, it may ricochet inside the body and do those kinds of things. Medium velocity is typically handguns. High velocity is typically rifles. Oftentimes people don't realize that a medium velocity, a 45 caliber pistol is considered medium velocity, whereas a 30-06 is considered high velocity. Remember, we're talking about the speed that it's traveling. The most common source of penetrating injuries in the U.S. is firearms, of course, and this looks like, I'm not sure if that's a defensive wound or if that's very close range, or if that's a handling mishap, somebody mishandling a weapon. The severity of a stab wound depends on the anatomical area. Of course, what area has been stabbed, the depth it is, the blade length, and the angle of entry is all going to make a determination of how severe that is. Some wounds may result from cutting or hacking forces such as machete. Nick wounds can damage critical structures and require careful assessment. Wounds to the lower chest or upper abdomen may involve the thoracic and abdominal cavities, and the wound pattern reflects the mechanism of injury and should be documented carefully, including the direction of the wound. The severity of a gunshot wound is influenced by multiple factors. These include the type of firearm used, the projectile's velocity, and the size, as well as the size and design of the projectile. The distance between the victim and the muzzle also can affect severity. The anatomical location of the wound and the type of tissue or structure play a major role in the resulting amount of damage. Gunshots fire multiple rounds of pellets, or shotguns fire multiple rounds of pellets at once, ranging from a half dozen to several dozen. The density of the shot depends on the distance traveled, with very close ranges capable of causing severe catastrophic injuries. Rifles fire a single high-velocity projectile, and their grooved barrels spin the bullet for greater accuracy. Handguns, including revolvers, which hold 5 to 10 rounds, and pistols, which hold 2 to 3 times as many rounds, they do have rifled barrels that give handguns some spin for accuracy, but they're generally less powerful and slower than rifles and have a tendency to be less accurate, and that's going to depend a whole lot on barrel length. Ballistics is the study of objects in flight, usually bullets from rifles and guns. Once a bullet leaves the barrel, gravity begins to pull it downward towards the ground. So the trajectory is a curved path that the bullet follows as it falls while traveling forward. The farther the bullet travels forward, the more height that it loses along the way due to gravity. The seriousness of a gunshot wound largely depends on the type of tissues the projectile passes through. The tissues with high elasticity, like muscle, can better tolerate the stretching effects of that. Entrance wounds show the effects of initial contact to the tissue implosion. Skin and underlying tissues may be pushed inward and cut or abraded. And at close range, powder burns can leave tattooing-like marks on the skin. Extremely close shots can cause burns from the muzzle blast or the muzzle flash. When we look at the wounds and the gunshot wounds and the damage that the projectile causes to the tissue, we look at that deformation and tissue destruction that result from the projectile's density, the tissue's compressibility, and the missile's velocity, and whether the missile fragmented while it passed through. As a projectile penetrates, it crushes tissue and creates a permanent cavity along its pathway. The projectile's track may be a straight line, or it may be an irregular pathway depending on its behavior once it makes contact with body tissues or bones. The pathway expansion, a temporary cavity, actually occurs when the pressure wave displaces tissue at or near the speeds of sound, and it creates a transient cavity. So while the wound path may seem small, it may seem like a small wound path, it was actually much larger in a higher velocity weapon because it actually creates a larger cavity. Inelastic tissues like the liver, spleen, brain are less able to absorb that cavitation and therefore suffer more permanent long-term damage. Missile fragmentation produces secondary fragments that carve out additional separate pathways as they travel through the tissue. Exit wounds happen when a projectile retains enough energy to leave the body. The size of the exit wound is going to depend on how much energy is dissipated as it travels and the degree of cavitation at the exit point. These wounds usually have irregular edges and may be much larger than the entrance wound. Multiple exit wounds can occur if the projectile fragment's inside of the body before it passes through. Shotgun injuries occur when numerous of these small little projectiles strike tissue. The greater the distance from the muzzle, the more increased the pellet dispersion will be, and honestly, depending on the shotgun, the greater the chances of survival. The injury severity depends on the powder charge, the pellet size, and the number of pellets in the dispersion. Pellet dispersion is affected by the firing range of the weapon, the barrel length, and the type of choke that the weapon has. Is basically the design of the vehicle, as well as the distance from the end of the barrel to the object that it strikes. Determining the type of weapon that was used, estimating the distance which the weapon was fired, and identifying the type of bullet or ammunition involved is going to be really helpful. You'll also want to record how many shots were fired or heard, and inspect the wound for powder residue or tattooing, so it'll give you an idea of the distance between the weapon and the person that was shot. Identifying and documenting the entrance and exit wounds is also really important. Whenever you identify an entrance wound, you should immediately look for an exit wound, especially in the chest cavity. If you've got a sucking chest wound, for an entrance wound on the front side, you very likely may have one on the back side that you're not seeing. Oftentimes exit wounds, depending on the velocity of the weapon, the higher the velocity, oftentimes the exit wounds are larger and create more damage. All right, so that is part 1 and our introduction to trauma on chapter 30. I will see everyone back at part 2.